I'm Dr. Cleo Prince. I'm a chiropractor. I've been in practice for over a decade, so I'm celebrating 11 years in practice this year. I practice in Durban, Richards Bay, as well as here in Empangeni. And I enjoy practice because patients walk into my practice feeling despondent, full of pain, uncomfortable, and they walk out with a smile. And I think that that is the best part of my day, and partly the reason why I became a chiropractor, to help people and to make a big difference in their lives. And I'm embarking on making a big difference in the tiniest of patients, where I will start to further my education into pediatrics, so my little babies, through to the toddlers, to teenagers and beyond, and how I can manage them more effectively, more efficiently, so that we can set them up for a well-adjusted life. Definitely get moving. Don't sit or have too much of a sedentary lifestyle day in and day out. Even if it stretches at your desk, for every 1 hour that you sit, stretch maybe for 2 minutes. Incorporate movement in many ways. You don't have to have a gym membership. You don't have to make this an extra thing that you have to do. Park further away from the entrance at work. Even when you're going to the shopping mall, park at the furthest parking to the entrance. If you can walk somewhere instead of driving or taking public transport, rather do that so that you can incorporate that movement into your daily life much easier. I would say also stay hydrated. Your spine does not have its own blood supply. And by it not having its own blood supply, nutrients cannot get into your spine. And furthermore, water makes up about 80% of your joints. So hydration helps to keep those joints nice and supple and helps to extend the life of your joints. Good nutrition, eating a well-balanced diet will definitely help with spinal health. We want to have a diet that is rich in variety. Okay, you don't want to eat one food group versus the other. We don't also want to be eating a lot of unhealthy foods. So good nutrition is very important. And lastly, I would say to avoid smoking. Smoking, I think, is probably one of the worst things that we can do for our health, and especially for our spinal health, again, because it dehydrates your spine and in that way causing pain and degeneration early on in life. I would say they're all equally important because your adjustment, your posture and exercise, it's all going to work together. They all work synergistically to bring about good spinal health and to make sure that your spine stays healthy for as long as possible. So as I have mentioned, incorporate movement into your day, because at your desk job you're sitting between 8 to 9 hours every day. So I would say make it a habit that for every 1 hour you do a stretching break or a water break, you walk around, even if it's just to go say hi to your colleagues, if it's to walk to the printer, walk to the coffee machine, add some form of movement, some form of stretches into your day, into your daily routine. As I said also, you can park a little bit further away from the entrance, take the stairs instead of taking a lift. And hydration, put that water bottle on your desk so that every time you look at it, you take a sip of water and just keep yourself hydrated throughout the day as well. So I would say that we're seeing such a decline in the use of painkillers and anti-inflammatory medications. And that has been coupled with the increase in the use of chiropractic. And it's because patients are starting to realize that they don't have to run to the pharmacy first to go and get medication to help with their pain, because also medication has side effects. So there's some patients who can't take certain medication because of the side effects that they then experience. Also, another unexpected benefit is that we can actually help pregnant women. So pregnant women can't take certain medication when they are in pain, and anybody who has had children knows that your body goes through so many changes and it affects your spine in so many ways and your body in so many ways that you just want some form of relief. And I think that with chiropractic we can bring about that relief. And then also in our pediatric population as well, I think a lot of people don't know that we can actually treat babies, and we can help with things like colic as well as reflux and also restlessness in babies. There's a saying that goes, it's always a good day to get adjusted. So I think, we have patients who come through who want to come there for wellness. They come for an overall body check to just see, are there areas that they should be focusing their health on? Should they be correcting their posture? We get patients who come through when they are starting to feel a little niggle that's starting to come up. Or we get patients who come who they've tried everybody else, and they come to me and they say, well, it's either you or the vet, because there's something wrong and I don't know what it is. So we have patients who come through and they are in such severe pain that they don't actually know what has gone on. So I think chiropractic is there for everybody. Whether you are pain free and you just want to have a spinal check, whether you are really suffering from pain, whether you've given birth and you want a check for your baby to make sure that they're okay, to set them up for a good adjusted life. I think chiropractic is there for everybody, and everybody should consider visiting a chiropractor. Thank you.